cancer is often referred to as a silent killer and a leading cause of death in women, especially Nigerian women. Human papilloma virus, HPV, is the most common sexually transmitted infection that causes this disease, which has become a public health threat. However, the HPV vaccine is said to be the most effective against the infection when given to girls before they become sexually active. Nigeria introduced the HPV vaccine into its routine vaccine immunization program as part of campaign against the disease. Though this campaign faced some challenges, the federal government also set a goal and has affirmed its commitment to eliminating cervical cancer by the year 2030, aligning with the World Health Organization global strategy and target. Nigeria's First Lady, Oluremi Tinubu, has flagged off a new campaign partnership to scale down the scourge among Nigerian women. What could be the impact of these efforts in eliminating cervical cancer in Nigeria? These and more would be our focus on Nigeria Today. Thanks for joining us. I'm Ikaria Quinton. Now with me in the studio to expand the discourse is Professor Usman Malami Aliyu, the Director General and Chief Executive Officer, National Institute for Cancer Research and Treatment, NICRAT. It's a pleasure to have you on Nigeria Today.
Thank you for having me.
Now let's just go straight to the basis. What exactly is cervical cancer? What are the the common and the risk factors, the common causes and the risk factors, and how does it develop?
Okay, so thank you very much for the question. Cervical cancer, it is a disease that affects the cervix. When we say cervix, in a layman's term, it is the mouth of the womb. So it is a disease of the mouth of the womb that has the tendency to invade the adjacent structures that are surrounding that mouth of the womb, multiply, and then extend to the other parts of the body. In the scientific language, we call that attaining a malignant status. That is, it has the ability to embed and even penetrate and extend to the distant part of the body. And it is, if not controlled early, it has the tendency to take the life of the individual that has the disease.
So what are the common causes? The
common causes, I can say locally it is one of the cancers that the exact cause is known. And in this case, it is a virus. And the virus is called human papilloma virus. There are about more than 99% of all the cases. That virus has been found to be the culprit.
So how prevalent is it in this part of the world, Nigeria?
Well, generally in most recent statistics that has been presented by Globacom, cervical cancer has been found to be the second cancers in women, especially in Nigeria, mainly in Nigerian women. Breast being the first, the second being cervical cancer. In both sexes, generally, it is the third. It is the third.
Okay.
But in terms of mortality in the country, it is ranking the second. In the year, I think the latest statistic that we have from Globacom, which is an agency of WHO that reports the statistics of cancer in the country, in the world over reported that Nigeria, I think in that year, had there about 13,700 plus new cases, and almost there about more than 7,000 deaths were recorded in that 2020. So you can see how devastating the disease is. And what is more painful is that it is one of the disease that the cause is known.
No.
And yes, it's known. And we also have a vaccine
for it. Now, what are some of the, the signs, like for people that already have it?
All right. So, as you know, human papillomavirus is the commonest sexual infections that we normally have, in the population. At an earlier exposure or contact with the virus, patient usually it takes a long course to develop cervical exact cervical cancer disease. It can take from 10 up to 20 years. So yes, so that is why it is advisable to take the vaccine, because if you you may have the contracted the disease at a younger age, it will not manifest until later.
Later
in life.
So gradually
yes,
it keeps. So yes. Can you give birth with it, even with the cancer?
Yes, of course. Yes, of course. You can give birth with it, but of course, with some other complications here and there that you need more specialized care and expertise to actually attend to you. So at an early stage, it doesn't present with any...
No signs, no symptoms?
No symptoms. At least sometimes at an early phase. Yeah, but as the disease progresses, an individual starts to have like discharge, which some might assume that it's just a normal infection that women used to have, and then you go to a doctor who is not sometimes a specialist in that area. Will just give you antibiotics and say go home, it will. And some will even go to the pharmacy and take normal medication just to combat or make the discharge to stop. As it goes on, then the woman will start having what we call bleeding. Yeah, from her private part. That bleeding could be an intermenstrual bleeding.
What do you mean by that?
A woman has a normal period, that she normally sees. So if it's a bleeding that comes after the woman has completed her normal cycle.
Okay.
So that is what we call. So in between the two menstrual period, in between, which was actually supposed to be a resting period for her, she will just see the bleeding.
Okay, what should a woman do to prevent this kind of case? Because it appears it takes a longer time. A lot of persons will not even know that something like that exists. Yeah.
So what we are saying, knowing the exact cause of that disease is highly advisable that the woman, or right from let's say a young age, a girl child should have received or is supposed to take this HPV vaccine, at least. Currently what we are giving is we are giving this vaccine to our girl child that are aged 9 to 14 years. And this
that's for prevention?
Yes, for prevention. Okay. If you take it, confers immunity, so that even later in life, if that girl contacted the infection, the vaccine that she had boosted the immune defense of the body against that infection, so that at an early phase the body will be able to kill and eliminate the virus without allowing it to progress to the cancerous stage. So that is the importance of having the HPV vaccine at an early age, mainly let's say age 9 to 14.
You know, since you said we really don't know the cause of these.
We know.
Okay.
The cervical cancer.
The cervical
it's
cancer.
one, of the few cancers that we know. It's a virus.
The virus.
Human papilloma virus, which we also have the vaccine.
Okay.
Which is a good news,
Okay, you talked about the vaccine, and you talked about the vaccine being taken at a younger age. What is it? Just the children, say from the younger age of say 5? You talked about the age of
9 to 14.
9 to 14.
Yeah.
Okay, beyond 14, can't a woman take?
Well, beyond 14, they can actually, but you know, usually from most of the papers, the scientific publication that we are getting, the vaccine was reported to be more effective in those group of girls or women that had it at younger age group, mainly within 9 to 14, because of the the long course of the disease. But nothing stops a woman at 20 or at 26 or later in life from taking it. And because also of the cost of the drugs, you know, the government of the day invested heavily in collaboration with other partners that we have in the country. So it's a highly commendable thing that the government of Bola Ahmed Tinubu did with the support of Renewed Hope Initiative that is being championed by Senator Olu Rebi Tinubu, CON, to have launched that HPV vaccine. It was a great work, very, very expensive, because you can imagine the condition that the people are currently in the country. But the government procured, with some support from our partners, this medication, which you can get free at our primary health care centers in the country. Okay. So now, because of that, now the government set and plan who are the group of people that will benefit most from this medication, from this vaccine. And based on the scientific evidence that we have currently, it has been found and realized that, based on the reports, that girls aged 9 to 14 benefited the most. And if you are able to immunize or vaccinate, this group of people, you are subsequently conferring a kind of what we call herd immunity gradually to the other people in the community. It's like you are providing a kind of protection to the community, other normal populace that we have in the society. Okay,
so how accessible is this vaccine to especially people living in the rural areas and underserved communities?
All right, so the good news, if you can remember, when it was first launched, I think it was rolled out in 22 states, 18 to 22 states, I cannot remember the exact dates. And after some few months, it was also rolled out to other states. So currently it is in the National Immunization Program of the country. This vaccine can be found in each and every PHCs that we have. We have the functional PHCs, primary healthcare centers in the country. If you want your daughter to have it, just walk. Okay. You can have your healthcare workers that you can interact with, and he will tell you almost virtually everything you need to know about it, and you can get the vaccine free.
Thank you very much, Prof. We'll take a breather here. The conversation will continue after the break. Don't go away.
Of the ruling is also dependent on another aspect or another arm of government.
Nowhere in the world will allow under digital economy for banks not to be dispensing domestic currency in that economy.
What will make this one different?
We want to know what they do as occupation. All of these are attributes that our questions have been designed to investigate.
In a few days to come, you see that we are all around their own crannies and everywhere in Nigeria, telling people to cooperate.
Welcome to Nigeria Today. Welcome back. This is still Nigeria Today. We are looking at eliminating cervical cancer in Nigeria. And of course, I have a gentleman here in the studio to tell us all about that. Now, Prof, talk to us. How is your institute? Because you know we've not talked about your institute. How is your institute partnering to eliminate cervical cancer in the country?
All right. So my institute, that is the National Institute for Cancer Research and Treatment, it is a leading agency of government under the Federal Ministry of Health that is charged with the responsibility of controlling the menace and scourge of cancer currently in the country, the leading organization in the area of research. And one of the mandate of the institute is taking that leadership to ensure effective cancer prevention, cancer research, treatment, and control in the country. Now, in the area of cervical cancer, what part of the activities that the institute did was, one, to actually design a policy document that will guide the whole country based on the available data that we have on this cervical cancer. Because without a policy document, without a strategic plan, you cannot go anywhere. So within, I think, the first year of the establishment of the institute, the first thing we did was to actually draft that cervical cancer control plan for the country, of course, together with WHO, Clinton Health Access Initiative, and other Federal Ministry of Health and other supporting partners. So using that cancer control plan, the institute was actually able to plan the activities surrounding improving the health awareness campaign in the 6 geopolitical zones of the country, which I think we at NTA covered some in the year 2024. We've been around the regions, in the country, merely improving the knowledge of our populace on what is cervical cancer, what are the common risk factors, and of course even the healthcare workers. There were a training to upgrade, train the trainer to upgrade their skills on how they attend to the cervical cancer patient. Still on the issue of cervical cancer elimination, the institute, in collaboration with the Ministry of Health, champion the declaration of November 17 to be the World Cervical Cancer Elimination Day world over. It was the effort of the institute, of course in collaboration with the Federal Ministry of Health, that the Minister for Health, the Coordinating Minister for Health and Social Welfare, now reach out to the WHO that this is what we want in the country. We bidded Nigeria and South Africa, and during the just concluded World Health Assembly, it was announced that the whole world adopted that November 17 to be the World Elimination Day. Having said that, the Institute now constituted a national task force committee on cervical cancer elimination, of which a renowned professor in the area of obstetric and gynecology, which is Prof. Isaac Adewale, the former Minister for Health, is chairing.
Okay, now you've talked so much about what the institute is doing in terms of policies, and of course putting all it has together for the elimination. Now, what are you doing in terms of awareness?
Okay.
Because if the people don't understand, they don't know, nobody comes forward to say, okay, I need this, because we have a lot of misconception about vaccines already.
So we are generally, I've started telling you on what we are doing, going around the 6 geopolitical zones in different states to actually improve the awareness on people on that. But of course, as I've mentioned, we are following our national strategic plan, which aligns with the World Health Organization cervical cancer 90-70-90 elimination strategy. And the key goal of that 90-70-90 is that we ensure that we screen, or that almost 90% of our girl child that are aged 9 to 4 get this vaccine at the age before or at 15 years of age. So this, we've been telling people the importance of that, and this vaccine has been rolled out. In fact, the institute, aside from the routine immunization or vaccination with this HPV, we just, some few months back, we've just concluded rolling out the girl child that were missed, to boost out the uptake of that disease.
Okay, so sorry to cut you short, Prof. You talked about the virus taking a longer time to manifest. What if the vaccine is given to someone that already has the virus? What happens?
Okay, so as I've mentioned earlier, that even if you are out of the 19 and 14 years that we have mentioned, you can benefit from the disease. Even
from
if
the vaccine?
You have, yes, the vaccine. So even if you have the disease, in most of the studies, some are saying that if you take it, although it's not prohibited, but the response that you get is low, because you already have, you understand, you already have this disease. So some specialists are totally against, but some are saying that even if you have the disease, if you take it, at least you can get some. But if you use your common sense, it is a preventive issue. The whole aim of this vaccination is prevention.
So how accessible is the treatment for this cervical cancer for those that already have the virus?
Well, actually, if you, the federal government or the National Primary Healthcare Development Agency under the able leadership of Dr. Mui Aina has already stated clearly the age group that will benefit most from, and because we do not have a large cost because of the expenses of the money, and we do not have it for, let's say, virtually at once, everybody, because it has to be prepared and we have to procure it. So the people that will benefit most from it are the ones that we are covered under this program.
So prevention is better than cure. That's what
prevention is better than cure. Once you get your child immunized with this vaccine, it confers live immunity.
Thank you very much.
It prevents from
Professor Usman Malami Aliyu, the Director General and Chief Executive Officer, National Institute for Cancer Research and Treatment, NICRA. Thank you so much for coming on the program.
Thank you for
sharing all these thoughts with us.
Thank you very much.
And thank you for being part of the program. Don't forget, Nigeria Today is every weekday at 7:30 a.m. And you can also check out this episode and others on www.youtube.com/NTA News 24 Hub. Once again, thank you for being there. I'm Ikaria Benton. Goodbye.